Good evening, everyone. We are happy to host this last session. It's about women in leadership, or people championing women's health in leadership. So I'm very happy to have a great panel of people who are going to come over. So I will request that we start with the introductions. So the first panelist who's going to join us is Dr. Christine Sadia. Dr. Christine Sadia is the chair of Kenya Medical Women's Association and vice president of the International Medical Women's Association for the region. Karibu sana, Dr. Sadia. Then the next one is, sorry, I can't read there, I'm too old. Ms. Krupali Shah. I'm long-sighted. So Ms. Krupali Shah is the technical director, Revital Healthcare. And we're going to hear very good things about what Revital Healthcare is doing in the field of healthcare, as well as championing for women's health. Okay, then third is Ms. Jennifer Kinyoe, who is the country manager for East Africa for GE Healthcare. So karibu sana. And we have a gentleman, Mr. Gregory Roxon. Yeah, who is the co-founder and CEO of M-Pharma. So karibu sana, Gregory. That's welcome in Swahili. So this session is going to look at recognizing African leaders who are advancing women's health on the continent. And we are looking at spaces that have radical changes in health indicators, in visibility, in positioning of women in Africa. These champions can be found in all subsectors of Africa's healthcare system. That's the private, public, and development sector. And for this area, the discussions will focus on the challenges and lessons learned within their journeys, success stories and wins. And we'll also look at how do we promote good leadership and how do we reward champions in the areas of women's health and development. So as we were preparing, I was preparing for this session, I decided to look up the word leadership, especially leadership in public health. And there was one of the definitions which said, the ability of an individual to influence, to motivate, and to enable others to contribute toward the effectiveness and success of their community and or the organization in which they work. It involves inspiring people to craft and achieve a vision and goals. So my great panelists on this stage up here are each going to share the journey of their organizations or also individuals within their organizations and what they've done. So we'll start with Dr. Christine Sadia. So Dr. Christine Sadia is going to present a couple of slides on what Kenya Medical Women's Association has done so far. Karibu sana, Doc.
Thank you very much, Liz. You should have added that you're also a member of the Kenya Medical Women's Association.
Sure.
And I think we have in the room Dr. Kitulu, who was the chair before me several years. And I've seen a few, Dr. Kihiga is here. So we are many. And let me start from this point, that you've seen those women that have counted. If I've missed one, my apologies, but they are leaders in their own right. I would like to thank the organizers of this organization, of this symposium, and all protocol observed. I would like to start from the first slide. I think that's in outline. I will give an introduction, then what was our flagship project, which was called World Woman Clinic, and then give a rationale why we need to transition at this particular point to a women's health hub and center of excellence. And then I will do my concluding remarks or a parting shot. So the next. We speak to this brief slide of how Kenya Medical Women's Association started. It was founded in 1983 by 12 women doctors, two dentists and 10 medical doctors. So it's an association of women doctors in Kenya, both medical doctors and dentists. Kemwa was founded when there were great needs that were felt at that particular time, that the health sector had failed women. And these women really wanted to be game changers into the space, and you will read for yourself maybe the mission then. What did we start the Kenya Medical Women's Association? It is because the field was male-dominated, so they were not thinking health or doing policies that were geared to the voices of women. Because when they were planning, they had no experience of what women go through. The next was that at that particular time, the women doctors were very few in the training institution. So we took it upon ourselves to go to schools and inspire women in science and technology, the STEM, to come and take the practice of medicine, which we have achieved. I think right now in Kenya, we are either having parity or the women have tipped the scale. So those were the things. But the next thing was that women were not accessible, were not accessing health in the right space, in a convenience of women. And therefore, our slogan was a supermarket approach, a place convenient for a woman where they could come and just be themselves as women and experience the services with other women doctors and or women practitioners in a one-stop shop, so that the out-of-pocket expenditure could be minimized. But at the same time, when it was a supermarket approach, the life cycle approach, which it is now hitting the globe now, so no wonder Kemwa was ahead of its time. We said from womb to tomb. We were looking from a woman from the one in the stomach to when we take them to the grave. So the realization of our vision is, I'll only pick a few. We have a documentary for 35 years of Kemwa's life, and it is very rich. If you would like to get it on request, it will be available. But I want to state that when we began, I've said those things that motivated us to start, and I think we can go to the flag. Let me speak a bit on the setup of the flagship program, the Well Women's Clinic. One-stop shop, a supermarket approach, giving women every product that they wanted, and looking from women, not only from their, women are in different strata. You could be financially disadvantaged, but that's not our reason. The reason was what look of women in their own diversity. So the women who are able to come and access the services will put something small so that they can support a woman who could not access the services. In this space, I think the next slide, let's speak to the next slide. The impact that the Well Woman Clinic had. In the 80s, Kenya had only Kenyatta National Hospital offering cervical cancer screening and treatment services. And Kemwa took it upon itself that because there were so many women that were not being screened, we got ourselves to get the machine, the colposcopy machine, and we trained doctors at Kenyatta. We got 2 professors from Belgium, the University of Ghent, and one from Canada, to come and give the technology, the capacity building that was required in the country. The LEAP, that is the loop electrical excision procedure, the LEAP, was only available at that particular time in Kenya. We started small, but we have seen our growth. We have reached more than several thousands of women for now. Well Woman Clinic was also a research center with the University of Ghent, the way I've said, and we looked at different products. We are the ones who researched and supported the global initiative on HPV, and we are glad to report during Dr. Kitulu, the HPV virus, the HPV vaccine with GSK was launched in Kenya. So I would like to recall those great women that did those researches. So for example, we also wanted to get a technology that if you do a smear, then it's conventional pap smear. And we did this research with it was called Cytorich Project, a program with the Roche there, and I'm glad they are in the room. We started with them way back in the 90s, so that what was the effectiveness if you put it in the liquid base or if you put a slide and you examined it. So I will move from there, but I would want to say this. The Well Woman Clinic, the Well Woman clinic is a concept of KEMWA globally. We have patented it, but we have left it for use to benefit women. The next thing that we did was syndromic management when HIV/AIDS and STIs came in. So we researched our women, very energetic women researched and got the concept of syndromic management of STIs. That is also a first for KEMWA. And with PATH, we did FGM, and we have those products we can share. The recent one is the Depivarin vaginal ring, which is now we are lacing with even if family planning, whatever, so that women can access. So we can move. Those are the impacts we've made, but they are more beyond it. In fact, when the Philips were talking, and I'm sure they're in the room, we did what we call from Cairo to Cape Town, where we ran with the ultrasound. We introduced ultrasound to rural women so that they could see the benefit of technology. It doesn't scare them. So those have been done, and those are things that we have documented. Could we move to the next one? What is the need for transition for now? Why we need to transition is this. Having done those big achievements, research, innovation, a little bit of innovation that we have, a few we have patented on adolescent pregnancies, we looked at the global architecture for the last 3 years, and we've seen that the globe was moving towards digitalization, technology, and we said we cannot sit in one space. So we would like to be the voice that bring the STEM women in science and technology, but through the lens of the women in medicine. We want things, technology that are working for women, that speak to the voices of women that are maybe today are not in the room, but KEMWA sits in that space that they speak to the voices of those women. So we are now moving to a women's hub and a center of excellence where we will take this technology, use them, see how friendly they are for women, how are they working for women, and they give you the evidence that either makes you to make the industry players, to make the next generation, or to customize them so that they can work for women. So in this center, what we anticipate or what we want to do is more research-driven and data-driven, when we are also continuing to do what was in the Well Woman Clinic, perfect it with new technology, with new machines that give us efficiencies and turnaround time for our time so that we can see many. Because we have not been able to close the tap. Women keep on still streaming, but we think that with the technology we will be able to reach more women than we are. But we also will be a center where we can inform, do capacity building, and do many other things. So that's the brief rationale of what we are having. And in the space of ICT, e-health or data-driven telehealth enabled, I think we would be able to also train, like Dr. Kiara had said, we need to look at the human resource. We may have all the tech, but if there is no capacity within the people who are using the technology, for us, technology is a supportive instrument to help the practitioner do much better with what they have. They diagnose correctly, efficiency is achieved, and therefore we would like to look at it that way. And therefore, evidence that is coming from the practitioners and speaking to the voices of what the women would like to see or what works for women is what we would like to speak to in the center. I know my time is running out, but quickly, there is the issue of scalability. What I like about technology is the scalability. It will bring up to scale because, like I said, we were not able to scale up very quickly. Next. Well, I will just pick those points. Mission, we have said what we want to do in the hub. It is evidence-driven. Training and capacity building, I think Dr. Kihara had already spoken. Deployment. How do we deploy the technology in a manner that works for all women in their diversity? Because what is bringing the issue of us in Africa not making a dent and reversing or utilizing our gains is because we have not looked at the disparity amongst the women. What works for a woman in the rural area who has no money, who cannot make a decision on her own. So we want to bring that disparity, the issues of disparity in health. And therefore, I like talking about, because I'm a gender and development specialist, what I like talking about, the desegregation between sex. There's something in sex and gender that if we do not dissect that, and with social determinants of health, as a global health expert, we will not be able to make a dent, and that's where we would like to go in this center. I hope the next slide will be maybe almost my concluding slide, or yeah. So why gender medicine? I'm also a gender medicine expert. The reason why gender medicine is, if you look at those examples that I've given, and one that I gave in the morning, we are not speaking to the voices of women. We have normalized the pain of women. A woman comes with a period pain, and you tell them it is normal. There's nothing normal in a period that it's having pain. Don't normalize the experience of women, or when they come to deliver, you say, oh, labor is normal. There's nothing. Let us not normalize. They are also human beings like any other. Therefore, the human rights and ethical application to health must apply to all women. And therefore, those are some of the things I've given. I will give the last one. When a woman is aging, like myself now, osteoporosis becomes a problem. Why? I think the people, the clinicians will know. And those are the things that we want the gender medicine to change. So in this space, we will be doing a lot of research and giving you evidence on gender medicine. But at the same time, we have developed a curriculum for gender medicine, and we would like to be supported with people who can give us tech that to train health workers to begin to understand the gender medicine and how that works. So I'll conclude by saying this. We want to be a community. We already are a think tank and a community of practice. So we would like to leverage on our expertise. We catalyze practice change, and we would like to develop innovative approaches. So overall, if that overall priority sits in your heart, then for us to be game changers by looking at those disparity and experiences of women, and bring the voices of women on the table, so that whatever that we do, whether it is the tech that we develop or it is the clinical intervention we are doing, we have it with the women at the heart of it, and what their experiences have been. We have documented those experiences, and therefore we can give women quality of life and well-being, because they don't just have to live. I know they live longer than the men, but they live with disability. So we want to give them quality of life. And thank you for your attention.
Thank you. Thank you so much, Dr. Sadia. We could hear the passion. So we hold our thoughts on that as we shift from professional association to the industry. And that is Ms. Krupil Shah, who will take us through a presentation on Revital, what they're doing, and then we'll have a short video afterward. Karibu sana.
When we speak about maternal health is linked to both our women and our children. It is interdependent, it is interlinked. When we speak about maternity, it includes both women and their children as well. When something affects our children, it affects our women, it affects our society. And when it comes to health, no one should be left behind, especially not our most vulnerable population, the newborns, who are struggling to breathe within just their few days or few hours of their life. So every mother deserves to see her child grow. When we're speaking about our children, these are the most vulnerable population, the neonates who have just been brought into this world, and they're struggling within the just few hours, a few days of their lives to struggle to breathe. And this is something that we want to be able to address. Next slide, please. Nearly 4 million infants die each year, with 1 million dying principally from respiratory insufficiency, especially in low and middle income countries that lack the respiratory support technologies that is commonly available in high income countries or high resource settings. So with the aim of addressing this, Revital Healthcare partnered with the Vayu Global Health Foundation, which is based in the USA. Next slide, please. Together, we have come up with a solution to be able to address this challenge. So we present to you the world's first and only CPAP system for neonates and infants that is able to provide a blend of air and oxygen to these infants, but without the use of any electricity whatsoever. This is perfect for low and middle income countries because we cannot always rely on electricity for the provision of oxygen to our newborn babies. So with the Vayu BC-PEP system, not only is it low cost, not only does it not require any electricity, but it is able to provide a blend of air and oxygen with adjustable concentrations to these neonates, helping them breathe in the first few days of their lives. Next slide, please. We've already received approvals in Kenya, Tanzania, the US FDA. It's been deployed across 10 countries worldwide, saved thousands of neonates' lives, given hope to their mothers, giving them hope that their babies are going to survive, that they are going to survive. These babies are our future generations, they're our future leaders, and if we don't help them now, then who is going to help them? Next slide, please. We want to ensure that this device is available globally, and so organizations such as National Institutes of Health, UNITAID, Bill and Melinda Gates Foundation, Save the Children Foundation, they have all taken interest in the Vayu BC-PEP to ensure that this global access is provided across. In Kenya already, it's been implemented in Kenyatta National Hospital. In Tanzania, it's been implemented in Muhimbili National Hospital, and the feedback that we've received from the
Recording in
nurses,
progress.
from the mothers, from the neonatologists, from the pediatricians who've all used this device, their feedback has been excellent. It's simple to use, it's easy to maintain. It's a simple, tiny, portable device that can just stay by your bedside, and the mothers have been so happy to see their babies survive on this device and reduce the mortality rate drastically. So this is an innovation that Revital together with Vayu has come up with. Africa still is lacking behind in technology when it comes to supporting or reducing the global mortality child rate, and we aim to be able to address this with what we do at Revital Healthcare. And as such, I'm so proud to be working with the Revital Healthcare team that not only supports women empowerment, but is dedicated towards creating an inclusive healthcare sector across Africa.
So we shift gears and go to Ms. Jennifer Kinyoe, who's the country manager East Africa for GE Healthcare. Thank you.
Revital Healthcare is a medical device factory in Mombasa, Kenya, and we are the largest manufacturer in Africa for medical devices. I'm the founder of the company, and I started this company in 2006. Official opening was in 2008 by His Excellency President Mwai Kibaki.
Revital is founded on the basis of understanding that there's a huge gap in Africa when it comes to healthcare. Hence the reason why Revital saw the growing need of putting a state-of-the-art manufacturing facility to cater for the growing demand of various medical devices, and to also ensure that Revital and Africa stays self-reliant on countries from Asia and Europe for the medical devices.
We started with manufacturing 2 products, and today we have 44 products on the lineup of medical devices. We are the only manufacturers of vaccine syringe in Africa. The PQS4 vaccine syringe that we have is called an immunization syringe. From the 7 manufacturers in the world, which is WHO PQS certified, Revital is one of them.
We export to Europe, several countries around the world. We supply to UNICEF, WHO, and several other organizations. So it's extremely important for a medical device industry such as Revital Healthcare to have the right qualifications when it comes to certifications as standards as well. Hence, Revital Healthcare has been accredited by ISO 13485 CETUV, which makes Revital able to export to any country in Europe without any registration processes. Revital Healthcare is one in 7 manufacturers in the world which is WHO PQS certified for the auto-disabled and reuse prevention syringes which are currently being used for COVID vaccination. The consistency of the standards of our products are maintained with our in-house quality assurance team. During production processes, we always have a quality inspector on the ground inspecting every single product at every single stage of the process. This ensures that the final product which reaches the end consumer is free of any defects or any deformities, which makes Revital Healthcare #1 preferred manufacturer in Africa and beyond.
COVID-19 has affected the whole world in many ways that we've never seen before. The whole medical industry was put at strains that, again, were completely unprecedented. The demand of medical products over the past year has increased significantly. As manufacturers, Revital had to step up to make sure that there was sufficient supply for the world. We increased our manufacturing capacity from 40 million medical devices to 80 million medical devices in 2021, with the goal to hit 120 million medical devices by 2023. In addition to the increased capacity, Revital Healthcare introduced new products such as our surgical face masks, COVID-19 VTM kits, COVID-19 gowns, and many other more products to make sure that Africa and Kenya is supported through its pandemic resilience. We discovered a comparative advantage of manufacturing world-class medical devices in Kenya. This ensured we increased the number of countries we supply to from 18 in 2018 to 24 countries in 2021.
I had 60 people when I started in 2008. Today I have 500 people working. We started with 4 million to 7 million syringes a month. Today we are the largest manufacturer of medical device in Africa.
Revital Healthcare is constantly innovating and entering new areas of healthcare. One of such devices that we're going to start manufacturing at Revital Healthcare is the Nowell BCPAP system, the Bubble Continuous Positive Airway Pressure System. Nearly 4 million infants die each year, principally from the lack of respiratory insufficiency. The BCPAP is a non-invasive ventilator that it's simple to use, easy to maintain, provides a blend of air and oxygen adjustable to a concentration of 30% to 100%, and does so without electricity. Revital was first approached by a professor of Harvard University, Dr. Thomas Burke, with the intention of manufacturing the BCPAP device locally in Kenya. Another exciting project at Revital is the project for the rapid diagnostics tests. Effective treatment is only possible if you have the correct diagnosis and an effective way to diagnose the patients. We have locally started manufacturing the COVID-19 rapid antigen test kits. The biggest advantage that Revital Healthcare has in manufacturing these rapid diagnostic tests locally is that it would reduce the reliance on imports of these rapid tests from outside.
It makes me feel amazing coming every single day and knowing that what we're doing over here in Revital is saving every single life that we possibly can. In fact, a lot of our competitors constantly kept telling us, you'd never be able to compete with China, you'd never be able to compete with India. But look at us 13 years down the road. We have a state-of-the-art factory and we're supplying to countries in Europe, we're supplying to UNICEF as well as WHO.
Every woman is unique, her own body, shape, and distinct contours. We believe that the mammography system not only provides the most advanced imaging, but should be sensitive to the comfort of every patient, regardless of her individual anatomy. So we collaborated with those who are most intimate with the mammography experience: technologists, radiologists, and most importantly, women. Our goal? Design a groundbreaking mammography platform that marries the need of women undergoing examination with those of medical professionals. The result is nothing less than the reshaping of the mammography experience. Senograph Pristina is engineered to ease a woman's anxiety from the moment she enters the exam room. Clean lines, sensitive design, and newly imagined ergonomics enable a space of comfort and support. For the first time, self-guided technology allows women to achieve the compression that is right for them, helping to reduce anxiety and remove potential barriers to effective care. To help improve communication and patient comfort, technologists can now position patients while facing them, making the process easier and faster. 3D capability provides exceptional image quality at the same dose as standard 2D mammography. Brilliant imagery, sensitive design, the ultimate focus on patient comfort. GE Healthcare brings it all together. Senograph Pristina, destined to reshape the mammography experience forever.
GE Healthcare is committed to delivering precision healthcare for women across the continent. We have some of the best innovations, and today we'll be talking about breast health. So you've heard about maternal and child health, you've heard about women's health from when you're born, and now we'll talk about breast health and what GE is doing. So globally, we have more than 15 next generation multimodality personalized breast care and digital solutions. Some are in person, others are virtual, and these are offering medical practitioners the imaging tools and support that they need to improve patient-centered care and support the doctors as they make decisions. And when you think about it, what stops women from screening is because there is a lot of anxiety and fear and misinformation that's related to breast imaging. Some do not want to know the actual results of the breast imaging. Some fear that the mammography might be painful. And so what we've done as GE Healthcare is developed a mammography machine that is actually controlled by the woman. So you have a remote control as you're doing your mammography. You decide on the pressure you want to put on your breast, and therefore you walk in there with confidence, and you're able to actually just do your mammography in a calm manner. The survival rate is perceived to be very low, but actually that's not the case. If screening is done early, then survival rate is actually not that bad, and that has been proved in the Western world, where people do screening much more than we do here in Africa. And obviously there is lack of human resources. There are not enough doctors, technologies that can actually operate this equipment and get the women's health to where we want it to be in Africa. So we have partnered with MOH's ministries of health across Africa to try and improve the situation of getting access. And I'll talk about our first project. It was a breast cancer screening awareness campaign in Nyeri County in 2019, just before COVID. We worked with the MOH, the National Cancer Control Program, and the Nyeri County government. Over 1 month, we did a campaign for breast cancer screening, and we targeted women between 40 and 74 years, which is the recommended age for screening. The screening was done through the GE mammography machines, the Senograph Crystal, not the Pristina. And you'll find these machines in 47 counties in Kenya. They were part of the MES project that was done in 2015. Mammography is obviously the only method that has been proved to be effective in detection of breast cancer. In this campaign, 10,000 women turned up within the month, and a lot of them who had anything peculiar in their results have been followed up, and they continue to be followed up. And we keep in touch with the county to just make sure that this is being done. Over 50 community healthcare volunteers and 30 healthcare professionals were trained to support the campaign. So that's our first project. The next project I'm going to talk about is the Kenyatta University Cancer Center. As you all know, last year the president launched the Kenyatta Hospital Cancer Center. This center was built in partnership with GE Healthcare. We did the groundbreaking, we did the trenches, we were involved in the civil works and the equipping of the center. We equipped with cancer equipment that is life-saving. Kenyans no longer have to go to India for their PET CTs. The PET CT is available right here. As a matter of fact, there are 2 PET CTs there. Since the opening, Kenyatta University Hospital has already done more than 200 scans. And that was only October last year that it was launched. It's a world-class center of excellence for the country and the region. And Kenyans will now stay at home. During cancer treatment is a time when you need to be with your family, and therefore no more travel. You can be right here at home with your family as you're getting treated. Then I want to talk about a little bit about the MES project, where we equipped 47 counties and 5 referral hospitals with mammography equipment. In as much as the utilization has not been the greatest, we believe that we've taken the care and the screening all the way to the mwananchi in the counties. So any county you go to in Kenya, you'll find the equipment that is working, has 95% uptime guarantee, and women can now be screened whenever they need to. We just need to work a little bit harder as government and private sector to make sure that this equipment is being utilized as it should be. And then we have one-stop breast clinics projects that we've done. We've done one in Egypt, whereby a woman walks into a clinic, you're screened, your treatment is changed in the event that you're found with a tumor or anything, and then you're treated in the same clinic and you're followed up. So with a one-stop breast clinic, which G is rolling out very soon in some parts of Africa, women will be able to walk into a clinic and live, as a healthy person, and a follow-up is done within the same clinic. Then we've had partnerships with companies like Roche in French-speaking African countries to set up mini screening programs, right? We've had continuous educational events across the continent where we are supporting radiology staff, because we know that the biggest challenge is you can have the equipment, but if you don't have the staff to run this equipment, then it becomes a challenge. So those are a few of the projects that we're doing to improve lives in moments that matter and make sure that the women are healthy and are living a healthy life. Thank you.
Thank you so much, Jennifer. So we've had from speaking as a woman who's needing care, we've had from the one-stop clinic. I've had preemies before, so I totally appreciate the role of the CPAP machine. I have been told that I can go and do a self-breast mammography that I control myself. So, Mr. Gregory, I don't know what you have to offer for me as a woman, so take it over from there.
It's actually great to be the only man on the panel. I don't have much to say that has been said, but I think it's more of reflections on some of the work that these great companies here have been doing, and also MFAM has been doing. So I'd like to start with the first reflection, which is that there's this, one of my favorite TV shows is actually a medical series called Chicago Medicine. And there was an episode in that there was an episode in the series where it was a patient who was about to die, and the doctors were doing everything to save the patient. And there was a quote which I think is very important when we talk about women's health. And that quote was, treat the patient and not the disease. One of the biggest challenges that we've encountered when we talk about women's health is that we try to sort of build women's health around specific themes, right? That women's health can only be concerned around contraceptives. It can only be concerned when you link it to pediatric care or maternal health. But I always say this, that a woman who needs contraceptives could also be a woman who has diabetes. That woman could also have cancer, could have a heart condition. And so, in a way, our focus on women's health must focus on the whole person health, whereby we are not building solutions that only provide women with specific segments of care, which then shuts them out of sort of broader ecosystem of care that they can get. I think this is very reflective even in the research that goes into how new therapies are created. So let's take, for example, cardiovascular disease. The early research in cardiovascular disease was really based on men, right? So the early symptoms for heart disease were symptoms that we expected men to have, which is why, unfortunately, women are 50 times more likely to be misdiagnosed when it comes to cardiovascular health, and are more likely to die if they have a heart attack. And so for us, at the start of sort of transforming and making women's health a priority should be how do we ensure that we are integrating women in the research that goes into whole person health, and not just only when we are thinking of specific solutions that we think only women need. So one of the key projects that we launched at M-Pharma, we're very big on oncology. And one of the big projects that we launched actually came out of COVID. At the beginning of COVID, one of the biggest issues was the lack of molecular diagnostic capacity. And so we played a key role in West Africa in scaling molecular diagnostic capacity across the region in the private sector. But as we build that capacity, we said to ourselves, wait a minute, actually, what happens when we are trying to address the issue of cervical cancer? We know whilst sort of the rest of the world has moved towards HPV testing, as sort of the primary mode of screening, we have most often relied on, whether it's the pap smears or the aseptic test. And so with this capacity built, we actually last year launched what we call the 10,000 Women campaign. And the idea was to begin to shift diagnostic methods and say, well, one of the blessings of COVID, if there could be a blessing of COVID, was that it forced the scale-up of molecular diagnostic capacity on the continent, right? At some point, the volumes of COVID testing would not be as we needed in 2020 and 2021. What we should do is to make sure this capacity that we've built doesn't go to waste, and we can repurpose this capacity to actually advance diagnostics in areas that have been far ignored. So we launched the 10,000 Women campaign to begin to drive the shift towards HPV testing, becoming hopefully the primary mode of cervical of HPV screening and cervical cancer screening. And what was really interesting, at some point I called my team and I said, I feel we have in Ghana, we have a potential huge crisis of cervical cancer. We took a village that, you probably wouldn't think of it when going to try to do cervical screening. Went to that village and it was free. So the 10,000 Women campaign is free, offering the first HPV test for free to 10,000 women. And of the samples that we tested in that village, 40% came back positive. And 15% of those samples were positive for the high-risk strains. So you wonder, that is just a village somewhere in Ghana. And so for us, it sort of reinforced what we believe, that this excess capacity that we've built through COVID for molecular diagnostics should drive in actually making sure that cervical cancer, which we already know is a big problem, doesn't get out of hand. And early diagnosis is critical. And so we are advancing that work. We started in Ghana, going in Nigeria, and hopefully want to bring that in East Africa. But for us, it's a wake-up call that we all need to make sure that we are actually integrating the primary screening of cervical cancer as a core part of what we call wellness screening, and not just as a sickness screening. The second part is on breast cancer, which our head from GE and the Kenya Medical Women's Association. In 2019, M-Pharma and Roche partnered in Nigeria. One of the biggest challenges, we all know Herceptin is one of the best medications for treating HER-positive breast cancer patients. Unfortunately, it's out of reach for many women. Most national health insurance programs don't cover that, private health insurers don't cover that, so the only way you get treatment is actually paying out of pocket, and most patients can actually pay out of pocket. There's the research in Nigeria that had shown that women who even were put on treatment will most often drop off after the 5th vial, whilst you actually need 18 vials of treatment. We couldn't just sit back and wait for when insurance will include that in their coverage, so we decided to take it in our own hands and begin to create innovative programs around how you could leverage interest-free credit to extend the duration that people pay for care. So we wrote a program called HER-Radio, Herceptin Radiotherapy. And what is exciting about that in the last 2 years is that women that have gone through that program have actually completed treatment. We've gone from women dropping off after the 5th vow to actually women completing 18 cycles of treatment. In as much as it is great, what actually saddens me the most is that we actually have to turn down a lot of women, because in as much as we would want to bring in as many patients to a program like this, not everyone qualifies. And there are some patients who the only answer is free. And that is something that we're not able to do. And so that also sort of brings up a new challenge, as we are building evidence around how we are increasing the lifespan of women that are going through these programs. How do we integrate that into public policy to ensure that even women who do not have access to funds, even if you create long-term credit programs, which is interest-free, they can still get treatment regardless of their financial situation. And finally, sort of coming back to my earlier point around whole person care, MPharma, one of our critical works that we do has been investing in pharmacies and transforming pharmacies into primary care centers. About 2 years ago, we acquired Halton's in Kenya, and today, transformed Halton's from just a pharmacy retailer to actually a primary care provider. Because the key question for us in trying to move towards whole person care is how do we begin to integrate services at a community level that ensures that you can actually move from self-medication to managed care, whereby the financial decisions that women make when seeking care, which most often, it's not about whether I get care or not, it's about whether I have the financial ability to pay for care. Really, that is really the biggest barrier, is the financial ability to pay for care. How do you move that conversation from one where, because I do not think I have the financial ability to pay for care, so I will try to treat myself, and when things get bad, then I'll try to go get whole person care, to say, well, if we wait for that to happen, that is when you create medical emergencies. And we know it is much more costly to treat medical emergencies than it is to catch it early and prevent it from becoming a medical emergency. So over the next 3 years, what we've focused on doing at MPharma is creating what we call the sort of front door to care, whereby we can, at its sort of earlier stage of disease progression, actually reduce the cost that women pay. So a key example is, how do you reduce the cost of physician examination? Where today, patients, and women included, who walk into any of these pharmacies can get examined at no cost, right? And you can still pay for your medicines, but that examination, that can help trigger that sort of decision around, do I seek more care or do I stop at this level? You can make that decision earlier. And so at MPharma, really, our focus moving forward as an organization, outside these very specific themes of cervical cancer and breast cancer, which we are creating through partnership with some of the organizations in the room today, is to reimagine how we can leverage our pharmacies that we are creating across the continent to become the front door for care, and definitely prioritizing women when they walk through that front door to ensure that that financial decision and calculus that they make to determine if they get care or not is reduced. Thank you.
Thank you so much, Gregory, for tackling one of the biggest pain points. And we know women do not prioritize their care if there are other pressing needs like food and other basically budgetary expenses in the household. So thank you for trying to offer a solution to that.
All protocols observed. Dear colleagues, thank you for inviting the Global Fund to share some of the thoughts and few words with you. The Global Fund is a partnership that invests to end HIV, TB and malaria as a public health threat. To date, the partnership has saved 44 million lives. I am one of them. It also seeks to strengthen health systems so that they are responsive to the existing epidemics and resilient and sustainable in responding to new epidemics like COVID. All the things I have stated cannot be achieved without the strong partnership with private sector. We cannot break the back of the HIV, TB, and malaria without the strong support of private sector. Defeating these diseases means that we have to join hands in investing in targeted, evidence-based, high-impact interventions. Evidence is showing us that we need to invest interventions that are targeting adolescent girls and young women. The gender inequalities, gender-based violence, and limited access to education continue to put women and girls at risk. 2022 is an opportune time and a critical year for global health space to focus on women's health agenda. The Africa Health Business Symposium is a great platform to host this discussion. It has a key role to play in showcasing the African private sector leadership, innovation, and the Africa private sector creativity in advancing the women's health agenda. The Global Fund values the partnership with Africa Health Business as it is focusing on increasing local-led engagement in health, building advocacy, voices of business leaders, mobilizing resources, and identifying innovative solutions to our challenging health issues. Addressing gender and human rights barriers to accessing health services is one of the pillars of the Global Fund strategy. We increased investment in 13 sub-Saharan Africa countries in order to reduce new infections among adolescent girls and young women. $55 million for innovation matching funds was invested towards programs targeting adolescents, girls, and young women. The support we receive from private sector and foundation is important to tackle the health challenges women are facing. Investing in community healthcare workers, which was a very strong response to COVID-19, who are the backbone of the health system, is in many countries has proved to be a great investment. Most of those community healthcare workers are women. These unsung heroes have strengthened health systems in many countries and have saved lives, and we are in the business of saving lives. We need to invest to build resilient health systems that respond to existing epidemics and new pandemics like COVID-19. 2022 is the year of the Global Fund replenishment hosted by the US President, President Biden. To have a successful 7th replenishment, we need to join hands. We need to mobilize resources. We need voices from civil society. We need voices from affected communities. We need voices from the public sector. And most importantly, we need voices from the private sector. The Africa Health Business remain a key partner for the Global Fund. All the best in your deliberations. We look forward to your continued support. Thank you very much.
Thank you so much. I want us to applaud our panelists as they go back to their seats.